If you're over 55 and your legs feel heavy, cold, crampy, or just not like they used to, I want you to listen closely. Because circulation issues in the legs don't just affect comfort. They can affect your mobility, your independence, and your confidence to do the things you love. And the sooner you support healthy blood flow, the better. Now, before we get into the vitamin, I need to say something important. You'll see wild claims online, like boost blood flow 1,000,000 times. That's not how the human body works, and I'm not here to sell you hype. I'm here to help you take a smart, safe step that actually makes sense, especially after 55. Quick question for you, and I want you to answer in the comments. When do your legs bother you most? When you're walking, at night in bed, or when you've been sitting for a long time? Tell me what you notice and how long it's been going on. All right, if I had to pick the #1 vitamin I want most adults over 55 to check first, specifically with leg circulation in mind, it's vitamin D. Not because vitamin D is a magic blood flow pill. It's not. But because vitamin D deficiency is extremely common as we age, and low vitamin D levels are consistently linked with poorer vascular function, higher inflammation, and worse outcomes in conditions that affect arteries. In plain English, when vitamin D is low, the inner lining of your blood vessels, the endothelium, often doesn't work as well. And that lining matters for healthy vessel tone and circulation. Here's why this matters for your legs. Your legs are far from your heart. They're also working against gravity all day. And if you have any narrowing in the arteries or stiffness in the vessel walls, or reduced flex in how those vessels dilate, your calves and feet tend to be the first place you notice it, especially with walking, hills, stairs, or long periods of standing. Vitamin D's job isn't to open arteries like a drug would. Its job is more like supporting the environment your vessels live in: immune balance, inflammation control, muscle function, and signals that affect the vascular lining. And when you correct a true deficiency, some people notice better exercise tolerance, less achiness, and improved overall stamina, which indirectly supports better movement. And movement is one of the most powerful circulation boosters you have. So how do you use this information safely? Step 1. Don't guess. Test. I want you to ask your clinician for a simple blood test called 25-hydroxy-vitamin D. That's the one that reflects your vitamin D status. Why do I push testing? Because taking too little won't help, but taking too much for too long can cause real problems, especially high calcium levels, which can lead to kidney stones, constipation, confusion, and other issues. Step 2. If you're low, correct it with a reasonable plan. For many adults, a common everyday range is around 1,000 to 2,000 IU of vitamin D3 daily. But your right dose depends on your current level, your body size, sun exposure, diet, and medical history. Some people with significant deficiency are prescribed higher doses short-term. Again, that's a clinician-guided decision, not a DIY project. Step 3. Take it in a way that actually absorbs. Vitamin D is fat-soluble, so I generally recommend taking it with a meal that contains some healthy fat, like eggs, olive oil, yogurt, avocado, nuts, something like that. Consistency matters more than perfection. Step 4. Recheck. If you're supplementing because you were low, recheck your level in about 8 to 12 weeks, unless your clinician suggests a different timeline. The goal isn't as high as possible. The goal is adequate and safe. Now, I also want to protect you from a very common trap: focusing on a vitamin while ignoring the real reason your legs aren't getting enough blood flow. So let me ask you to do a quick self-check as you listen. Do you get cramping pain in your calves when you walk that eases when you stop? Do your feet feel unusually cold compared to the rest of your body? Do you have slow-healing sores on your toes or feet? Do you notice shiny skin, hair loss on the lower legs, or weak pulses? Those can be signs of peripheral artery disease, PAD, which is not something you treat with supplements alone. PAD deserves proper medical evaluation because it can raise the risk of heart attack and stroke. And the treatments that help most are things like supervised walking therapy, smoking cessation, blood pressure control, cholesterol management, and sometimes medications or procedures. And while we're here, I want you to know the urgent red flags. If you have sudden severe leg pain, a cold or pale limb, sudden numbness or weakness, or you can't move the foot like normal, don't wait. That's urgent medical care. Okay, so where does vitamin D fit into a bigger leg blood flow action plan you can actually do? Here's what I recommend, and I want you to pick just one to start today. First, walk in a way that trains circulation. If you have leg discomfort with walking, a proven approach is interval walking. Walk until you feel moderate discomfort, stop and rest until it eases, then walk again. Over time, this can help your body build better efficiency and small vessel support. If you have known PAD, ask about supervised exercise therapy, because it's one of the strongest non-drug treatments we have. Second, hydrate and don't ignore protein. Blood volume and muscle health matter. Dehydration can make you feel more cramped and sluggish, and adequate protein supports leg muscle, which acts like a pump to help blood return upward. Third, look hard at the big three that sabotage leg circulation: smoking, uncontrolled blood sugar, and uncontrolled blood pressure. If you smoke, I'm going to be direct. Quitting is one of the fastest ways to stop further damage to your vessels. If you're pre-diabetic or diabetic, stable blood sugar protects nerves and vessels, and blood pressure control reduces wear and tear on artery walls. Supplements cannot outwork these basics. Fourth, review your meds and symptoms with someone who takes you seriously. Some medications can contribute to swelling or cramps, and sometimes what feels like poor circulation is actually nerve compression, spinal stenosis, venous insufficiency, or a combo. The right solution depends on the right diagnosis. Now let's circle back to the promise in the title. No vitamin boosts leg blood flow 1,000,000 times. But vitamin D is a smart place to start because it's common to be low after 55, it's easy to test, it's inexpensive, and correcting deficiency supports the systems your vessels and muscles depend on. If you want a simple takeaway, here it is. I want you to stop guessing and start measuring. Ask for the 25-hydroxy vitamin D test, then make a plan based on your actual number. Pair that with consistent walking and risk factor control, and you're stacking the odds in your favor, safely. Now tell me in the comments, have you ever had your vitamin D level tested? And if you have leg symptoms, what's the one you want to improve most? Cramps, cold feet, swelling, numbness, or that heavy, tired feeling?